Now after we spread the protective pad underneath the resident, we need to put a towel behind the back of the resident because we were gonna give a full bath starting from the upper torso of the resident. No? Now, Miss Amy, if I can assist you to sit down. Okay. And then we will get our towel and we will set our towel behind the resident. Now the towel is set, we will remove the gown as well from here, holding the other corner of the privacy blanket to cover the gown of the resident as we remove the dirty gown. And also we will do it on the other side. Now as we remove the gown of the resident, we need to start with a stronger arm and then assist the resident to lie down. So I'm saying. Locating the dirty gown on the other side of the body. Again, we go on the other side of the resident and take away the dirty gown. Make sure that the resident is covered at all times. And now we remove the remaining sleeve from the weaker arm, assisting the resident. Now this gown will go straight to the dirty linen. Now we can start for giving the resident a proper bed bath. We will start on the face of the resident. If I may assist you to your proper pillow. Okay. Now, on our first towel, we need to squeeze the excess fluid. And then we will apply soap in 4 lips of the towel. If I may show you on these 4 lips. Okay? We apply soap. 1, 2, 3, and 4. Now we need to clean, give a bed bath to the resident 1 part at a time. Now we will start on the face. Miss Amy, I'm gonna rub your eyes starting from the inside out. Okay. And then fold the first lip, go to the other side. Then for the third one, we wash the whole face area. And then the last one is in the nasal area. Okay. And then we set this aside. Now whenever we wash, we need to rinse. We get our second towel, squeeze the excess fluid, or water rather, and then we will rub the parts that we rubbed before the same way like we did with the soap. Eyes. The other one. Next lip. The whole face area. And the last one for the nasal area. Okay. And then we set this aside. And then after we rinse the face, we will dry it using our towel that we set aside. Dry it gently. The same stroke like what we did when we are applying soap and rinse in the nasal area. And then we set aside the towel. Now we are done with the face. We are now going to apply soap to the upper torso. In this case, we will only apply, first squeeze the excess fluid. In this case, we will just apply soap in one part, one side of the towel. Because we will only apply one wiping only, the towel should go intact with one another. We will start applying soap under the ears, the chin area, the other ear, the upper torso, the left arm, the right arm rather. And then if the resident is female, yes, the underarm. If the resident is female, you need to wipe the breast area. The area under the breast, you need to lift it a little. And then in the abdomen area, down to the waist. To the stomach, down to the waist. And then, we set this aside. Oh, sorry. We need to put it back on the basin for later use. Now, another towel. We squeeze the excess fluid. Now this one is for rinsing. We will do the same stroke that like what we did, applying the towel without soap. So, under the ears, chin, under the face, underarm, arms, upper torso, the breast part, under the breast part, to the stomach, to the abdomen, and then we set this aside. After we rinse that part, we're gonna dry it again using the same towel that we use for drying the face. Dry it, same stroke like what we did. Arms, upper torso, the breast, under the breast, to the abdomen, down to the waist. Now what we did to the other arm, we will do the opposite to the other arm. Okay. Then we set aside the towel. Now we will give a back rub to the resident. Miss Amy, if I may ask you to roll on your left side, please. Go ahead. Now we will give a back rub to the resident using our third towel that we used before to the upper torso with soap. We will rub the back of the resident down to the lower back, to the buttocks, all the way down, wiping it one stroke only to the buttocks, and then set this aside. And then we get another towel for rinsing excess fluid, and then we rub it again with one stroke from top to bottom, upper back, lower back, waistline, buttocks, and then we set this aside as well. After we rinse, we will dry it again using our towel. Now after we dry the back of the resident, if the resident requests to put lotion on her back, so we will give a little. put some lotion on our hand. Make sure that before we apply the lotion to the back of the resident, it's warm. Okay, we apply. And then we assist the resident to a lying position. You can relax now, Miss Amy. Now, we will change the gown of the resident. Now we're gonna start with a weaker arm, like we always do. Put in the hand of the resident, like we are shaking hands. Then we assist the resident into a sitting position. If I may assist you, Miss Amy, to sit down. All the way up. Now we go to the other side and we'll do the same thing. This one is the stronger part, so we will not be having much problem with this side. Can you give your hand now, Miss Amy? Okay, and then we secure the back of the resident. And then after we secure this, we can now take off the towel at the back of the resident. And just go straight to the dirty linen. You want to relax now, Miss Amy? Okay. Now we're done. We're done with the upper part of the resident. We will proceed to the lower body of the resident, but first we need to change the water of the basin. Again, as per procedure, check the temperature of the water if it's okay, and then ask the resident to check the temperature. Please check the temperature, Miss Amy, if that's okay with you. Okay. The temperature is okay, we can proceed. Now, we need to remove our gloves and put another one. We need to throw it. If it is necessary, if the resident requests for it, we need to provide also nail care and perennial care to the resident. But we already did that in our previous video, so we will proceed to the other part of the resident. Now we will lift the privacy blanket of the resident up to the area that we will be working on. That's enough. And then we put on our new set of gloves. Now in this, as we go on to the procedure, we will take another towel, squeeze the excess fluid. We will apply only soap at one side of the towel, and it will spread all over. Now we can start cleaning the leg of the resident from the nearest side, from the hip Lift it a little under the hip, all the way down. One wipe only. Up to the foot. We can also provide foot care if necessary, if the resident may request for it. Then we also do this thing on the other side, same. Now after we apply soap, of course, we will rinse. The same thing with the other hip, from top all the way to the bottom. Provide foot care if needed. If the resident may request for it, you can apply lotion. And then we need to assist the resident to put on some lotion if she requests for it. Now after we rinse, we need to dry it using our towel. Same procedure like what we did with the towel, with soap and rinse towel. On the other side also, foot care. Provide lotion if necessary. Now, we can pull down now the privacy blanket. And now, we need to dispose now our supplies. Okay? The dirty towels will go right straight to the dirty linen. We'll wash our basin according to procedure. Along the way, we will pick up our soap and lotion. Store it properly. Throw the paper towels. Now we need to take the protective pad underneath the resident. Can you please roll on your left side, please, Miss Amy? Okay. Roll it in. Tuck it to the hip, under the hip of the resident tightly. Then you can relax now, Miss Amy. Please lie down properly. And then we will pull it out on the other side. Can you scoot towards me, please? Then roll on the right side, please. Now we're gonna roll it in. We take it off. You can relax now, Miss Amy. Please lie down properly. We throw it. And also we will take the barrier and throw it as well. And now we remove our gloves. Pinch off the first glove, roll it, then the other one, wrap it inside, then throw it. Now we will take off the privacy blanket that we put on the resident. First we need to put up the top sheet while we pull down the privacy blanket. Now this skill requires the cooperation of the resident. So you can kindly ask the resident to cooperate while you are doing the skill. The privacy blanket must be rolled like a ball, making the dirty side rolled inside, and this go directly to the dirty linen. Now we will arrange everything. We will check the dress of the resident if she's comfortable. Are you okay, Miss Amy? Are you
Yes.
comfortable?
Yes.
You feel any pain?
No.
Okay. Do you need anything while I'm still here? A magazine perhaps?
No, thank you.
Okay, this is your call light. If you need anything, don't hesitate to call me, please. Okay. I'm gonna open your curtain and wash my hands. Now, after we wash our hands and make sure that the resident is comfortable for what we did, we document our procedure, make any corrections, take notes of any important observations and changes that we notice in the resident, and that's how you assist the resident for the bed pad.